Local 3 Share Your Christmas Food Drive, Friday, December 8th.
So as we go through the holiday season, part of the tradition and the fun for so many of us is making those family favorite desserts and brownies and fudge and all the good Christmas cookies that go along with it. So it's a sweet season for sure. Our next guest wants to make sure that you're doing it though in a healthy way, and if you're having some problems, she would love to help you. The she is Haleigh Dunning, and she is a public health educator with the Hamilton County Health Department. Good to see you this morning.
Good to see you.
So November is Diabetes Awareness Month. The truth is every month is a time to be aware of it.
Yes.
So your job is that you go out and kind of educate people on what to know, is that right, to be healthy?
Yeah, exactly. I do the Healthy Living and Wellness program at our health department, so I cover all sorts of topics from nutrition to physical activity, and then also certain chronic diseases like diabetes and things that are really impacting our population.
So let's break it down a little bit then on the diabetes front. There are the two types, type 1 and type 2. There's also pre-diabetes. We hear a lot about that, but what does it mean?
It basically just means that you are on that cusp of developing diabetes later on, and we want to the sooner that we can diagnose diabetes and make awareness of pre-diabetes, you can start making lifestyle choices that'll help you manage and control your symptoms and maybe prolong your full-on diagnosis of diabetes.
So when you, to me anyway, when you talk about lifestyle choices and lifestyle changes, if you are a person walking that walk and you're currently diagnosed, it can almost feel like a shame on you kind of thing if the messaging is not presented the right way.
Yeah, so you know, diabetes is a really complicated chronic disease. Over 31 million Americans, adult and children, have diabetes, and it's not just one simple lifestyle thing or factor that ties into your diagnosis, so no one should feel ashamed of it. But it can be quite scary, especially first getting diagnosed. It's a lot of things to be aware of and keep up with.
Well, and I guess the wonderful thing is because it can be scary, the reason that so often the lifestyle choices and changes are pushed is because you can ward off the really scary part of it if you just know what to do.
Yeah, so yeah, like with all those scary things, you know, it can hurt your nervous system, even hurt your eyes and your vision later on, and really affect your health in all sorts of different ways that you don't even realize at first, and that could be quite overwhelming. So I always recommend, you know, paying attention to that mental health aspect of taking care and managing your health is going to be one of the key factors first. So finding a community of other people recently diagnosed or loved ones to share your journey with, I'd highly recommend that as
well. Do you offer a community like that at the health department? I mean, do y'all have support groups or anything like that?
I can.
Or do you go out?
Yeah, I go out to the community in all different ways and educate on diabetes management, especially in like a group setting. So that's a great way for other people to connect and be like, oh, I've tried this, I've tried that. And it's really a cool thing to see as they connect over that when I'm teaching these lessons.
So we'll focus on the type 2 still for a minute, since that can change with the right action. If you have lived in a type 2 diabetic condition for, let's just pretend, 5 years, and then you step in and you make some changes and you get yourself out of it, years down the road, will there possibly be some markers though left? Like you mentioned, the vision concerns down the road.
Those type of things mainly are problems down the road if you're not managing.
If you're not managing it, okay.
So that's what we want to be preventing as much as possible. So like doing the lifestyle changes, being physically active, and watching your carb amounts and the sugar levels that you are at. I like to suggest for people who are trying to get on track with taking care of their diabetes to start with their ABCs. So start simple. So A for A1C test. So making sure you're getting your a simple blood check done at the doctor's office, and it tells you kind of your average of a blood glucose level that your blood sugar levels have been over the last few weeks. And then B, that is your blood pressure. Diabetes and hypertension and other aspects of your blood pressure and health in that way are very much connected and important to watch. And then C for your cholesterol. So you want to really make sure your cholesterol is also being monitored as well.
Okay.
And so that's a good first 3 things to kind of check off on your list.
Yeah.
And make it into bite-sized goals.
So for anybody watching who has the type 2 diabetes or the pre-diabetes, we've kind of addressed their issues. If you're a type 1, that's a whole different conversation. But at the health department, can you help with that as well?
I provide different resources on certain areas in our healthcare system around Hamilton County that can help you with finding resources on insulin and medication management type of things, and even working with healthcare providers and which ones are covered under Medicaid, Medicare, and all of that.
And I bet you have fun when people follow your advice and they do begin to put aside those sugary sweets and get to feeling better, to watch how much their lives improve.
Yeah, it's really impactful.
So here's where you can reach out to Haleigh if you want her to come and educate you or a group that you might know through the Hamilton County Health Department. You just simply go to health.hamiltontn.org. Pretty much any aspect of our lives when it comes to our health, the health department is there to be a resource. Thank you.
It's our pleasure. Thank you.
Hi, I'm BJ, owner of West Shore Home. At West Shore, we believe in giving back to our local communities. So right now, we're lowering our prices to help you get a brand new